Bismillah ar-Rahman ar-Rahim. This is the first lecture of thyroid cancer. The question now, how common is thyroid cancer? Close to 53,000 Americans receive a thyroid cancer diagnosis every year. Treatment for most thyroid cancers are very successful. Still, about 2,000 people die from the disease every year. We are seeing here case of thyroid cancer and here another case of thyroid cancer. Thyroid cancer is the most common malignant of the endocrine system, representing 3.8% of all new cancer cases in the USA and is the ninth most common cancer overall. We are seeing here case of the thyroid cancer and here another case of the thyroid cancer. The American Cancer Society estimates that 62,450 people in the USA will be diagnosed with thyroid cancer in 2015 and 1,950 deaths will result from the disease. We are seeing here case of thyroid cancer and here another case of thyroid cancer. Now I will talk about types of thyroid cancer. Thyroid cancer is classified into types based on the kinds of cells found in the tumor. Types of thyroid cancer include differentiated thyroid cancer, undifferentiated thyroid cancer, medullary thyroid cancer, and other cancers. Differentiated thyroid cancers. This broad category includes types of thyroid cancer that start in the cells that produce and store thyroid hormones, or called follicular cells. And the rate of this type of cancers, 93% of all cases of thyroid cancers. Differentiated thyroid cancer cells appear similar to healthy cells when viewed under a microscope. We are seeing in this slide follicular epithelial cells and parafollicular epithelial cells. From follicular epithelial cells originates differentiated thyroid cancer and undifferentiated thyroid cancer. Differentiated thyroid cancer consists of papillary thyroid cancer, follicular thyroid cancer, and other thyroid cancer, for example, hair cell cancer. Undifferentiated thyroid cancer or anaplastic thyroid cancer. From parafollicular cells or C cells of the thyroid gland originate medullary thyroid cancer. The vast majority of thyroid cancer patients, more than 80%, have the differentiated thyroid cancer, consist of papillary and follicular and hair cell cancer, which has an overall rate 97% cure of all thyroid cancers. Now, the first subtype of differentiated thyroid cancers is papillary thyroid cancer. This is the most common type of thyroid cancer, accounting for approximately 80% of all cases of thyroid cancers. Papillary carcinomas are slow-growing, developed from follicular cells of the thyroid gland. This is follicular cells. this case of papillary thyroid cancer. Papillary thyroid cancer can happen at any age, but it most often affects people aged 30 to 50. A small portion of papillary thyroid cancers are aggressive and may grow to involve structures in the neck or spread to other areas of the body of the patient. We are seeing here case of papillary thyroid cancer. We are seeing here slide of characteristics of histopathology of papillary thyroid cancer. Consists of crowded overlapping nuclei, margination of chromatin, central clearing, nuclear grooves, nuclear pseudo-inclusions, psammoma bodies, and the last one is papillary formations. Papillary thyroid cancer, this type of cancer may spread to nearby lymph nodes in the neck. But papillary thyroid cancer is generally treatable with a good prognosis. We are seeing here normal follicular cells of the thyroid gland, but cells here with papillary carcinoma. The cells is large, tightly packed cells, clear nuclei or open chromatin, irregular membranes, pseudo-inclusions. The second type of differentiated thyroid cancers is follicular thyroid cancer. This rare type of thyroid cancer usually affects people older than 50 years old and accounts for approximately 1 out of 10 cases, or between 7 to 15% of all cases of thyroid cancers. Follicular thyroid cancer is found more frequently in countries with an inadequate dietary intake of iodine. Follicular thyroid cancer don't often spread to the lymph nodes in the neck. We are seeing here case of follicular thyroid cancer. Follicular thyroid cancer, but some large and aggressive cancers may spread to other parts of the body. It is most often spread to the lungs and bones. In most cases, follicular thyroid cancer is associated with a good prognosis, although follicular thyroid cancer is somewhat more aggressive than papillary cancer. We are seeing here cases of follicular thyroid cancer and here follicular thyroid cancer. The third subtypes of differentiated thyroid cancers is heart cell thyroid cancer. Heart cell thyroid cancer is also known as heart cell carcinoma and oxyphil cell carcinoma. Is a rare thyroid cancer. This subtype of follicular carcinoma accounts for approximately 3% of all thyroid cancers. We are seeing here heart cell carcinoma, invasive capsula of the thyroid gland. Heart cell thyroid cancer is aggressive and can grow to involve structures in the neck and spread to other parts of the body of the patient. The last one, or the last types of differentiated thyroid cancers, is poorly differentiated thyroid cancer. This rare type of thyroid cancer is more aggressive than other differentiated thyroid cancers and often does not respond to the usual treatment. Now I will talk about undifferentiated thyroid cancer or anaplastic thyroid cancer. This rare type of thyroid cancer grows quickly and can be difficult to treat. Anaplastic thyroid cancer occurs in approximately 2% of thyroid cancer cases. However, treatments can help slow the progression of the disease. We are seeing here case of anaplastic thyroid cancer. Anaplastic thyroid cancer tends to occur in people older than 60 years, cause severe signs and symptoms such as neck swelling that worsens very quickly and may lead to difficulty breathing and swallowing. We are seeing here case of anaplastic thyroid cancer and here another case of anaplastic thyroid cancer. Now I will talk about medullary thyroid cancer. This rare type of thyroid cancer, approximately 4% of all thyroid cancers. Medullary thyroid cancer develops from C cells or parafollicular cells in the thyroid gland and more aggressive and less differentiated than papillary or follicular cancers. C cell or parafollicular cell is a type of cell in the thyroid make calcitonin hormone that helps control the calcium level in the blood. This is parafollicular cell or C cell. These cancers are more likely to spread to lymph nodes and other organs. They also frequently release high levels calcitonin hormone and calcinoembryonic antigen or CEA, which can be detected by thyroid blood tests. We are seeing here medullary thyroid cancer. We are seeing here medullary thyroid cancer spread to the lungs. Other rare types of thyroid cancers, other very rare types of thyroid cancer can start in the thyroid gland. These include thyroid lymphoma, which begins in the immune system cells of the thyroid gland, and thyroid sarcoma, which begins in the connective tissue cells of the thyroid gland. We are seeing here case of primary thyroid lymphoma, and here primary thyroid sarcoma. And we are seeing here undifferentiated pleomorphic sarcoma of the thyroid gland. The question now, what causes thyroid cancer? Experts aren't sure why some cells become cancerous or malignant and attack thyroid gland. Certain factors such as radiation exposure and a diet low in iodine and faulty genes can increase risk. Other risk factors include enlarged thyroid gland or goiter, family history of thyroid disease or cancer, gene mutations that causes endocrine disease such as multiple endocrine neoplasia 2A syndrome or multiple endocrine neoplasia 2B syndrome. Low iodine intake. We are seeing in this slide thyroid cancer risk factors, radiation including X-ray, genetics, iodine deficiency, age. 2 on 3 of cases are between 20 to 55 years old. Gender, woman, 3 males more than men. Other risk factors include obesity, high body mass index, radiation therapy for head and neck cancer, especially during childhood, exposure to radioactive fallout from nuclear weapons, or a power plant accident. We are seeing here thyroid cancer risk factors like radiation exposure, obesity, family history, family, gender. We are seeing in this slide established and potential environmental risk factors associated with thyroid cancer. For example, radiation, here volcanic environments and the magma enzyme, particulate matter or air pollution. When we are seeing here perfluorinated compounds, we are seeing here risk factor from metalloids, nitrates, heavy metals, pesticides, plasticizers. This is the risk factors perhaps causes the thyroid cancer. In the end of this lecture, thank you for all.